Thank you, Honorable Speaker and members. The question was for I to confirm that there is widespread medical insurance fraud that is perpetrated by health facilities in Kenya, and particularly within the private health sector, through practices such as unnecessary medical tests, scans, incorrect diagnosis, aimed at unfairly generating revenue for the facilities. Honorable Speaker and members, the issue of medical insurance fraud committed by health facilities in Kenya, including the private sector, is indeed a serious concern that has received attention from the Ministry of Health, regulatory authorities, and enforcement agencies. There have been reported cases of facilities engaging in fraudulent practices to unfairly generate revenue, such as impersonations, raising fake claims for patients who never received any service, ordering unnecessary tests or procedures, providing incorrect diagnosis, and inflating bills submitted to insurance providers. These fraudulent activities not only harm patients by subjecting them to unnecessary medical interventions, but also lead to financial losses for insurance companies and undermine the integrity of the healthcare system. Consequently, the Ministry of Health, the National Health Insurance Fund, and the Kenya Medical Practitioner and Dentist Council have taken action to address these issues, including suspending facilities found guilty of engaging in fraudulent practices. Currently, the prevalence of medical fraud as per external actuarial analysis stands at 20%. It is important for stakeholders, including insurance providers, regulatory bodies, investigative bodies, and law enforcement agencies to collaborate in identifying, investigating bodies, and law enforcement agencies to collaborate and identify, investigating and prosecuting individuals and facilities involved in insurance fraud. By enforcing strict regulations, conducting thorough audits, and promoting transparency and accountability in healthcare delivery, we can collectively work towards combating fraudulent activities and safeguarding the interests of patients and insurance beneficiaries. The second question, has the government conducted an inquiry into this matter? And if so, could the Cabinet Secretary table the report of its findings? I wish to respond as follows, Honorable Speaker and members. I want to confirm that the Ministry of Health, the National Health Insurance Fund, and the Kenya Medical Practitioner and Dentist Council have been actively addressing cases of medical fraud within the healthcare sector. Through joint efforts and investigations, several facilities have been identified and subsequently suspended for engaging in fraudulent activities that compromise patient care and violate ethical standards. I would like to note that authorities have indeed taken steps to investigate and address instances of medical insurance fraud. Efforts have been made to scrutinize the practices of healthcare facilities, assess compliance with regulations, and hold to account those found to be involved in fraudulent schemes that are detrimental to both patients and insurance providers. There are ongoing investigations by the Ethics and Anti-Corruption Commission, the Directorate of Criminal Investigations, involving 10 healthcare providers currently suspended by the National Hospital Insurance Fund Board. I have annexed the list on my response. As we collectively strive to uphold the integrity of the healthcare system and protect the welfare of patients and insurance beneficiaries, I encourage continued collaboration among stakeholders, effective enforcement of regulations, and clear communication to promote trust and accountability in healthcare delivery. Question 3, what measures has the government put in place to ensure accountability by healthcare facilities and to provide compensation to the victims of medical insurance fraud?